What is the critical treatment window for stroke? Imagine your brain as a busy city where every second counts. When a stroke happens, it's like a sudden traffic jam blocking the flow of blood and oxygen. The faster you act, the better the chances of saving the city's vital functions. The critical treatment window is the time frame after symptoms start during which emergency care can make the biggest difference. This window varies depending on the type of treatment and the patient's specific situation, but prompt action is always essential. For most ischemic strokes, which occur when a blood clot blocks an artery in the brain, the main treatment is intravenous thrombolytic therapy using a medication called alteplase. This treatment is most effective when given within 4.5 hours of when symptoms first appear. The goal is to dissolve the clot before it causes irreversible brain damage. The medication is administered as a slow infusion over an hour, with the dose carefully calculated based on the patient's weight. During and after the infusion, patients are closely monitored in an intensive care or stroke unit to watch for any complications. In some cases, especially when large arteries are blocked, doctors may perform a procedure called mechanical thrombectomy. This involves threading a tiny device through the blood vessels to physically remove the clot. Unlike clot-busting drugs, thrombectomy can be effective up to 24 hours after symptoms start, but the best results are seen when it is done within 6 hours. Recent research shows that for select patients with specific brain imaging profiles, this window can extend even further, up to 16 or 24 hours. This is especially true if the brain tissue around the core of the stroke is still salvageable, thanks to collateral circulation or alternative blood flow routes. Rapid imaging plays a crucial role in determining the right treatment. When a person arrives at the emergency room, a computed tomography scan should be started within 25 minutes. The scan helps identify whether the stroke is caused by bleeding or a clot, which guides treatment decisions. The results should be available within 45 minutes to ensure timely intervention. Once treatment begins, continuous monitoring is vital. Blood pressure, neurological status, and vital signs are checked every 15 minutes during the first 2 hours of clot-busting therapy. After that, assessments are done every 30 minutes for the next 6 hours, then hourly until 24 hours have passed. If the patient develops severe headache, sudden high blood pressure, nausea, or neurological worsening, the treatment must be stopped immediately, and a new scan is performed to check for bleeding or other issues. Follow-up imaging, usually with a CORT or MRI scan, is recommended around 24 hours after treatment to evaluate the brain's response and guide further care. The overarching message is that every minute counts in stroke care. Recognizing symptoms early, calling emergency services immediately, and getting rapid evaluation and treatment can significantly improve outcomes. The key is swift, coordinated emergency response combined with advanced stroke treatment options. Always remember, if you or someone else shows signs of stroke, immediate medical attention is the best chance for recovery. Consult healthcare professionals for personalized advice and care.